Hello and welcome. This is Invest Africa. I'm your host, Nozi Pumbandra. Thank you for joining me. It's not really rocket science that a healthy continent would be a wealthy one. People with better health are more productive and contribute to the economy. Little wonder then that healthcare is a pertinent issue globally. But in Africa, the recent Ebola outbreak has put the continent's healthcare system in the spotlight. With aid coming in from the West to contain the spread of the virus, it conjures up those stereotypical images of dark and diseased Africa. But from an investment point of view, this outbreak has highlighted a severely underserviced healthcare market on the continent. And it also seems that the numbers are certainly reinforcing this. By 2016, the market for healthcare in sub-Saharan Africa will be worth an estimated $35 billion US. With 11% of the world's population, and that number is growing, Africa has a mere 3% of the world's healthcare workforce. Now, according to the World Bank, an additional 90,000 doctors and 500,000 nurses will be needed in the next few years. The World Health Organization says that sub-Saharan Africa has 24% of the global disease burden in human and financial costs, and almost half of the world's deaths of children under the age of 5 take place here. Now, according to the World Bank, over the next 10 years, about 25 to 35 billion US dollars in new investment will be needed to meet Africa's healthcare demand. The numbers may be discouraging, but these gaps present an opportunity for healthcare investment and innovation. Join me now to discuss this. In Lagos, Dr. Femi Sonmono, he's a director at Purple Source Healthcare. And in Nairobi, we're joined by Dr. Felix Olale, the chairman of Excelsior Group. And with me here in Johannesburg is Gerrit van der Berg from Advanced Health Limited. Now, for you at home, if you'd like to join in the conversation, you can do so by using Twitter and following me at Nozi Pumbandra or at CNBC Africa. And of course, the hashtag is Invest Africa. Dr. Femi, maybe let's start off with you being one of those countries that are in an affected region. What does the Ebola outbreak show or reveal about the state of healthcare in the continent broadly, not just the affected regions?
Thank you. I think some of the issues that we've had in the healthcare sector have really been exposed by the latest Ebola crisis. So we have issues, as you said, with workforce. So we don't have enough healthcare professionals to the proportionate population. We have issues with infrastructure. We have issues with sort of the quality of training, and we have issues around financing. And all of those things were really exposed with this Ebola outbreak, even within the affected countries, as well as the countries that weren't affected as much, such as Nigeria.
Right. Dr. Olale, maybe let's bring in you coming with the voice from East Africa to get a sense of the key lessons that the Kenyan government as well as Kenyan healthcare players have picked up with this outbreak, even though that particular region, being East Africa, wasn't necessarily affected.
Yeah, no, thanks for having me. Look, I think it's critical to understand that in the world that we live in today, we live in a global world. So it's very easy to connect from Lagos, from Liberia, from Sierra Leone, and all these places that were affected, into Nairobi. So what the Kenya government did was something very smart. And this was first recognizing the threat that Ebola had to Kenya and to the region as a whole, Nairobi being a very big hub. Secondly, the other thing they did was to engage all the different stakeholders, including our development partners, including all the health infrastructure, including some of the private sector, such as Kenya Airways and the transportation sector, to say, look, here is the situation, and here is our plan and our protocol to be able to address this. So by actually staying ahead of the situation and engaging a large set of stakeholders, they were able to put in place protocols that would be able to deal with the threat of Ebola if it were to arrive in our at our footsteps.
Gerrit, what I'm hearing from Dr. Olale is proactiveness, and this is what the Kenyan government seemed to have done. What do you make of South Africa's reaction, and in particular the travel ban that we then also saw being implemented by the government?
I think what's very important now is that you first need to understand what the problem is and how do you deal with the problem. And I think that's what the Kenyan government actually did there. They actually said, this is a problem, this is how you deal, and this is how you put a system in place to secure your people from traveling. And that's very important for us to understand, is that what do we deal with, what are we going for before there's an outcry for stop everything. So once you've done that, then you're actually in a power position to decide what you're going to do and how do you treat that.
Dr. Femi, so it seems as if for Gerrit that he's putting through, it's really about understanding the complexity of the problem that you're dealing with. But one of the criticisms that have been leveled against African governments in response to Ebola was that it actually revealed that our response mechanisms were very, very weak. Is this a sentiment that you would share as well?
I think generally yes. However, I would say that a lot of Nigerians were pleasantly surprised at the speed with which the government was able to respond to the Ebola outbreak. I do think, as my colleague in Kenya has mentioned, it was a combination of a couple of factors. The fact that the government was working with the international community and they were working with the private sector, and that's what allowed us to be able to actually start putting in place processes to halt the spread of Ebola.
And of course, Dr. Olale, maybe let's move the conversation and look at the investment opportunities in the healthcare system, not only just because of what we've seen with Ebola, but broadly. Where do you get the sense that the healthcare gap could still be bridged, especially for low-income populations across the continent?
Yes, no, thanks for that. The reality is that healthcare is a consumer business. I think the other reality that we find as folks who focus on healthcare is that healthcare actually provides outsized returns to investors. So we look at the opportunity in East Africa, for example. East Africa has about a $10 billion healthcare market. And so what's happening now is a lot of players are starting to recognize this opportunity. The challenge comes into probably maybe three different areas. Number one is data, right? So is there enough information that can allow investors to make smart decisions and to be able to take on risks, to be able to see the returns that they are looking for? I think the second thing is actually focusing on the true need within the market. So you talk about low-income communities and talking about low-cost services, right? The services that we need in Kenya or that we may need in Nigeria or South Africa may not always be the same. So you really have to start off, like with any consumer business, with an understanding of what the need is within the local market, and then design and build programs and systems that basically address that particular healthcare need. I think the third thing is a question, coming back again to a point I made earlier, of how do we put all the stakeholders in a room, and how do we collaborate and better work such that each player plays a role within the healthcare sector. Government has a role in basic services and immunization and public health. Development partners have a role in helping us deal with crises like the Ebola crisis we're seeing now in West Africa. Private sector on their own also have a role, right? And that is to take ideas that are being locally generated, take a bit of risk, and those who are will indeed see outsized returns within the healthcare market.
Gerrit, that's precisely, I think, what you've tried to do in terms of trying to fill a gap where there hasn't been. Maybe talk us through the business model that Advanced Healthcare has employed and what it is that you're actually trying to meet.
I think that's very important if you look at the South African market at the moment, is that healthcare is getting very expensive. So what's happening, the hospitals are very expensive commodity that's actually going forward. So we as Advanced Health is trying to specialize in cost-effective procedures going for the theatre. Now importantly there is that we start to focus on short-stay procedures, meaning like the patient go in a theatre and come back the same day, actually to home. So by that we eliminate a lot of additional cost. You know, we don't have ICUs, we don't have medical beds, we don't have those big costly drivers in a hospital. So by that we can actually deliver a much cost-effective service to the community and to the public. And that's help us to actually have reduced rates and make it much more cost-effective.
What has been the traction in terms of the markets where you've penetrated, and what does your African footprint look like?
You see, at the moment now, we just started Advanced Health. It was listed in April this year. So what we try and do is we try and get our facilities properly up and running. And once they're up and running, we can maybe explore opportunities to go into Africa, help and assist the people. And there's many ways that you can actually do that.
Dr. Femi, would this kind of model be something that could find traction in Nigeria? Same-day hospitals that don't necessarily have ICU units that cater for long-term stays as an alternative way of getting into affordable healthcare?
Possibly. I think it's important to kind of know what the differences are between Nigerian healthcare market and South African healthcare market. South African healthcare market is a little bit more developed than the Nigerian healthcare market. So In cases of Avenue Health, I believe that if patients did need ICUs and other supportive services, there are probably mechanisms in place to make sure that those patients get to those services in a timely fashion. So what you're seeing in Nigeria is you are having these discrete standalone facilities that are similar to that. So people doing same-day colonoscopies, for instance, because they've realized that they don't need beds. It's a relatively safe procedure. People can be discharged the same day, and they can generate a lot of revenue from that. I think we have a way to go. I think we still need to build up all the supporting services within the country to allow us to then go in this slightly fragmented route. So I think we still have a ways to go.
Dr. Olale, would the environment be conducive to see a product, an alternative of this nature coming through to East Africa?
Yes, no, look, I think Femi is right. So the idea, if I can take this a step back, is to actually think about the system as a whole and to understand where the gaps are within each market. And then you want to tailor a service that actually addresses a true need in the market, right? So for my colleague in South Africa, they have this gap that they've actually seen an opportunity and they're trying to fill that. When I look at East Africa, we still have basic challenges of infrastructure. However, if we were to think about this at scale and actually design systems that deal with the public health situation, right, and the basic infrastructure, vaccines, water sanitation, and the likes, then think about outpatient care, right? Fully 80% of healthcare in Africa is primary care. So that's what we need, right? Particularly here in places like Kenya. Then once you've done that, you can start to think about these more specialized services that are very much tailored towards a segment of the market. But if you just go within one particular area and build these silos, you will not be able to actually see scale. You will not be able to see the types of returns that investors will be looking for.
So real-time market intelligence there coming through for advanced healthcare. But let's take a quick break now. But when we come back, more on healthcare in Africa. Welcome back to Invest Africa. Tonight we're talking about healthcare investment on the continent. Remember that we do value your suggestions and your feedback, so please do send us an email. That's to investafrica@abn360.com, or interact with us on Twitter, that is at CNBC Africa, or following me at Nozipho Mbanjwa. And remember that the hashtag is Invest Africa. Still with me, my guest, Dr. Femi Sunmunu. He's a director at Purple Source Healthcare, joining us from Lagos. In Nairobi, we're joined by Dr. Felix Olale, the chairman of Excelso Group. And with me here in Johannesburg is Gerrit van der Berg from Advanced Health Limited. Gerrit, maybe let's start back with you again. Although you have been recently listed, but no doubt you have a fair share of experience in terms of the appetite from a private equity perspective for healthcare. What do you think are the key considerations that investors are looking for before they bring their dollars through?
I think what's very important is that you must have a proper model in place. And number one, there must be a funding model. You know, these patients actually cost a lot of money to get the infrastructure up and running. That costs a lot of money. So I would guess the biggest thing here is that there must be medical aid backing for this. There's a lot of private patients as well, but you know, if you want to have secure investors that want to secure their funds into your facilities and into your market that you want to do, is that there must be a proper healthcare medical aid funding backing for this.
Dr. Femi, in Lagos, maybe let's come back to you to get a response to what Gerrit has put on the table. He has highlighted the importance of medical aid backing and funding if private equity investors are to release their dollars for investment in their healthcare space. Would you concur that that is a primary concern, or would there be other issues that you think investors are looking for?
I think private equity is really about making returns, so it definitely is an issue in terms of having a proper business model that shows where your revenue streams are coming from. And as he said, if I think it does depend on the market to some degree and the amount of information that's out there. So if you're dealing with sort of the mass market, I imagine that private equity would be less comfortable with relying on out-of-pocket payments for you to generate your money. Whereas if you can show that there is some sort of healthcare financing mechanism in place already that will be able to pay for some of these health services, they're more inclined to do so. But I think also the other really important factor for private equity or investors in general is really about the management team. So how is whatever the project going to be executed, and that really comes down to the people behind whatever that business model is, and that's one of the areas that I've found that private equity companies really pay very, very close attention to.
Dr. Olale, a financing mechanism has been highlighted as key, but when we look at our African markets, and in particular we look at medical insurance, it doesn't really give one the sense that it's very much developed. So how do we then navigate the space?
No, that's a great question. So in fact, if you look at the penetration of medical insurance in sub-Saharan Africa, it's a very paltry 3%, right? And yet what we see is that there's a tremendous need for risk pooling, there's a tremendous need for payments and payer plans that actually address some of the requirements for all kinds of provision of care within the sub-Saharan market. I think we have to almost look at this a bit differently, and I take a slightly contrarian view. The question I would ask is private equity the right vehicle, the right financing mechanism for healthcare in Africa today? And from the work that we've done at Excelsior, we actually think that that is not the right financing mechanism within the private sector. We did an analysis where we looked at about 200 facilities in Ghana and Kenya. We found that fully 80% of them required less than $100,000 in terms of financing. They needed a lot more in terms of business development. They needed a lot more in terms of management experience and skill building, help within markets. So really what I think the type of financing we need is angel money. It is venture capital. It is project-based financing where you can actually take the time to design a model that, again, works for your market.
Venture capital and angel investing, maybe not in the South African context, but if we look at broadly in the African context, do you get a sense that maybe this might be a viable option if we are to attract more dollars into this particular sector to match what the governments are doing, Gerrit?
I think there's a big possibility in this. You know, in South Africa, there's a couple of ventures where they call it private-public partnerships, the so-called triple Ps. And that is actually one of the things that can be rolled out to these countries as well, whereby we already have some facilities up and running. We can actually make our skills available and work with the different governments. We actually have sort of a skills transfer where you help them get the facility up and running. You build the facility, you help with staffing with the doctors and stuff, and then at the end of the day, you actually help to train them to make sure that the facilities are properly running.
Private-public partnerships, Dr. Olale, maybe let's bring that back to you again. And of course, the issue of risk sharing always comes back when we get to PPPs. Is this a viable vehicle in the healthcare sector?
Yes, and I firmly believe so. I think with the public sector fully offering 50% of provision of care and a much higher number within rural communities, you cannot ignore the public sector. And I think PPPs is a vehicle, if you do them in the right way and set up the right frameworks, that you can actually allow financing to get into the sectors where you need to. I'll give you one quick example. We're working on a project with the Kenya government where we're trying to put together a sustainable vehicle for financing HIV in Kenya. This is $1.6 billion. Will involve private sector, donors, as well as the government. And the idea is that we need to create a financing model that is sustainable, that actually addresses some of the needs that are local. So PPPs are a true model. South Africa has some great examples that I'm sure my colleague in South Africa can talk about. Nigeria has some great examples as well in the diagnostics field between GE and the Nigerian government out there in Lagos. So I think this is perhaps a tool, recognizing the public sector is a very key player within the healthcare market.
Dr. Femi, that brings us directly to you to get an assessment and an insight from you whether the PPPs on the ground in Nigeria are actually working. But most importantly, how do we make sure that they begin to improve or broaden the scope of lives that they reach? Because at the end of the day, the healthcare game is always going to be about numbers.
True. I think PPP is in its infancy in Nigeria at the moment. As my colleague in Kenya mentioned, there have been some examples with companies like GE partnering with the federal government in the area of diagnostics, but there are also various scattered examples of sort of manpower buildup as well that's being transferred with PPP. I think given the budget allocations for healthcare, which have really been kind of abysmal since the 80s and haven't really gotten up to the level that they were before then. I think that a private-public partnership is definitely the way to go in order to build up that particular sector. In terms of the intricacies of how they hash those out, I think it would be interesting to learn lessons from other countries that have engaged in private-public partnership type of arrangements like the UK.
Yeah.
So we just have to watch this space and see how it goes.
And then, of course, when we begin to look at the public space and aligned with the private sector space, the questions of the skills exodus always comes in. And this is particularly relevant in South Africa, where doctors and nurses are more attracted to the private sector because of the kind of remuneration that they'll get in that particular space. Have we figured out a way of ensuring that we create a win-win situation out of this?
I think at the moment there's not a win-win at the moment. What's very important is that we need to sit down around the table, we need to discuss it, we need to focus on what is the crucial points we need to work towards. Because at the end of the day is that there's more and more sick people we need to treat, we need to help them, but there's a limited resources, and I think you just said in the introduction as well about the shortage of nursing staff and doctors that's going to be.
Dr. Olale, to what extent is this something that is significant for investors? In particular, we saw those numbers predicting that we need at least more than 90,000 more doctors, almost 500,000 more nurses, just to have a healthcare system that is afloat, just broadly speaking, across the African continent. Are we able to attract and retain the skills that we need to keep the sector vibrant?
Yep. Look, there's no question that the fact is that human capital within healthcare is a challenge, and that is both within the arena of the healthcare workers, but as well leaders and managers. So we saw something like this in 2011 and set up a program at one of the business schools here in Kenya called Strathmore, where basically we would train MBAs in healthcare management. So these are leaders and managers focused on an African curriculum within healthcare, partnering with folks such as the Wharton Business School and Oxford. So that deals with the challenge on the management side. On the challenge of the health worker side, I might say something provocative here. I don't think that within our lifetime, we're going to be able to train 90,000 doctors. That's just not going to happen. So let's think outside the box here. Now, the reality is that there is technology now in Africa, right? The second reality is that when we look at the needs of what Africa needs in terms of healthcare, we may not need that many doctors. In fact, perhaps investing in nurses, physician aides, technicians, community health workers may be a smarter way to go. And in fact, when you look at feasibility and the amount of investment required, it actually takes less to train these workers who we need compared to doctors who have to go through a 5-year program and who may be underutilized in some cases, right? Particularly if they're highly specialized. And that then drives this exodus that you see because their skills are not as useful within our market.
Dr. Femi, is e-health or m-health the answer then? It sounds as if we need to see a greater convergence of technology and the healthcare system.
I think technology definitely has a role to play. I think what we're talking about really here is trying to find innovative ways to address our specific problems. And what Dr. Olale has said is very relevant. So yes, technology has a role to play in terms of making sure that things are a little bit more efficient, perhaps reducing costs. But innovation is not necessarily always about gadgets and connectivity. Sometimes it's just about, you know, what he said now, like cross-training. So training community health extension workers, for instance, to take on tasks that perhaps junior nurses can do, and thereby allowing us to really be able to utilize our resources more effectively. Some other areas to innovate will probably be around financing. I think for Sub-Saharan Africa, I think that that's a very important thing. So looking at things like community-based health insurance schemes that address the needs of the poorest of the poor, really, but provides access to healthcare for them. Those are the kind of innovations that we need to be thinking about.
Gerrit, a final comment just before we wrap up, maybe to get your views on the aid vacuum that we're seeing as many international donors also susceptible to donor fatigue are pulling out of the healthcare space and redirecting their funds elsewhere. are we finding that homegrown sources of funds are plugging that gap sufficiently, or are we at a brink of a serious problem?
I think what's very important there is that the people are putting money into the system to actually get results out of that. And I think like the two colleagues there in Nigeria and Kenya also said, is that there's a serious problem that needs to be addressed. And I think once you have a proper solution or a plan in place, then you can go to funders and say, help me with X, help me with Y, to actually put your money into the system. And I think once that has happened, then it's much easier to get some funding again.
Certainly sounds like investors are always looking for returns. That's it for tonight. Thank you for making the time to join us. And a very big thank you to my guests, Dr. Femi Sonmonu, Director at Purple Source Healthcare, Dr. Felix Olale, the Chairman of Excelsior Group, and Gerrit van der Berg from Advanced Health Limited. Please don't forget to send us your comments. The details are on screen. But right now, Bruce Whitfield is standing by to bring you Tonight with Bruce. From myself and the Invest Africa team, it's goodbye.